Arizona Family Health Partnership is a Title X grantee. We have 2 Title X grants, one for Greater Arizona and another one for the Navajo Nation. So we serve right around 35,000 clients every year, providing quality reproductive health services.
So we're very proud of the work that we're able to do around quality family planning. And as part of that, we use data, we use quality improvement, and we work with our delegates and our providers to provide the highest quality family planning services to our clients.
At the Arizona Family Health Partnership, we really feel like our role as the grantee is a supportive role and a role that provides technical assistance so that our delegate agencies can provide quality family planning services to their clients.
I think that engaging in quality improvement is extremely important. It's not something that's an option. That it's the only way that you're going to have external validation that what you're doing is standard of care and that you are providing the best care that you possibly can. You set a goal for yourself that this is going to get better and this is how we're going to get there, and you plan it out and you go through the process, and at the end you achieve your desired outcome. And that's got to be very satisfying.
When the program managers were looking through the data that we have through our centralized data system where we get our encounter level data, we noticed that highly effective methods weren't being utilized as much as we thought that they could be.
There was a perception, or some feedback actually, that we were getting from providers saying that they didn't understand or feel the need for us to be offering these methods.
When we started talking about highly effective methods, we had a lot of clinicians who were saying things like, oh, I don't insert IUDs because whenever I insert an IUD, the client comes back in a month or two and wants it removed because of the side effects. Or I don't insert Nexplanon because, same kind of a story. So there seemed to be a lot of anecdotal information that clients weren't very accepting of long-acting reversible contraceptions. So what we wanted to do was to look to see whether that was true or not. When we looked at the data a little closer, though, what we realized was that our data wasn't reliable enough to actually look at that issue yet. We did a little comparison to look at what the data in our centralized data system said compared to what was in the charts at the health centers, and we found that the accuracy rate ranged anywhere from 49% to 100%. So the first thing we did was a performance improvement project around cleaning up that data. And every quarter, we would send data back to the delegate agency and say, for this visit, this is what you said the before method was that the client came in on, and this is the method that you said that she left on. Can you please verify that for us?
So when we did find an agency that had issues, I went to that specific agency to find out, okay, what really is happening? There was one agency in particular whose staff member was very eager to find out why her accuracy rates weren't doing so well. So we actually brought in charts and we worked with our data manager to see, okay, what does it look in the data and what does it look like in the chart, and where is that discrepancy and how can we get it fixed?
We kept that performance improvement project going for each agency until they reached a 90% accuracy rate so that we could then have good data to look at for the next step of the project.
At our quarterly delegates meeting, we provided aggregate data from the results of this performance improvement project. We provided an overall data as well as delegate by delegate de-identified data so they could see how they compared to each other as far as LARC insertion rates and removal rate.
We knew we had success when we heard clinicians in our meetings saying things like, wow, that's really interesting, and I didn't realize that really the reason that most of our clients are having their long-acting reversible contraception removed is because they either want to get pregnant or their method has expired. So that was really nice to see that we actually were making a difference in clinicians' attitudes. And I think that largely came from discussion when we would have our meetings and present our data. And the discussions where we did have some early adopters who had some really great counseling skills that they shared with the other clinicians to help them to be able to work with clients to make sure that it was the right method for them. I think through the process, some of our clinicians clearly became more comfortable with how to talk about long-acting reversible contraception with their clients, and more comfortable with the idea of being able to offer that to everyone who walks in the door, regardless of whether or not they've had children and regardless of their age. And so I think that they feel more empowered to be able to provide better services to their clients.
My feeling is that whatever we have that has been demonstrated to be an effective way to help a couple or a family or a woman meet their reproductive life plan, that should be available to them. But they should make those choices on accurate information.
So since we've made these changes, it's been really exciting to see that a lot of the barriers to providing all methods have been removed.
At baseline, the rate of females having a LARC inserted was 2.4%, and we increased that by 4.5% at the end of the 2-year period. However, overall, 13% of AFHP clients have chosen a LARC method, which is on par with the national average.
I'm really excited about the improvements we made because I feel like if a woman has the ability to control her fertility and has those options available to her that best suit her, then that's a really exciting thing.
We are very proud of the work that we're able to do around data and quality family planning services. Process improvement allows us to dig into the data, improve a process or a service delivery, and provide the client with the best possible services. And in the end, that's exactly what we're here for.